Hello and welcome to another interesting episode of Elets Innovation Talk. I am your host, Dr. Asawari Savant, Senior Sub-Editor from Elets News Network, and today we have a very special guest joining us. Ms. Viloo Williams, the Group Chief Information Officer of Grant Medical Foundation, Ruby Hall Clinic. So, ma'am, thank you so much for joining us. We are so happy to have you in this interaction today.
The pleasure is all mine. I love to talk.
Same here, ma'am. I am definitely sure we're going to have a very good conversation. So, today's conversation will revolve around different topics that is, digital transformation journey, the vision of Ruby Hall Clinic, and many such interesting points. So, let us get started. So, ma'am, first of all, thank you so much. We get inspired by your work every day so much, but we would like to know more our audience, which is also from a B2B medical background, healthcare background, are very interested in knowing not just the current ongoings around the digital health journey or the healthcare space, but also about the person or the eminent speakers that we have. So can you please talk us a little about your background into this field, how you got into this space, what motivated you, and how your journey has been with digital transformation at Ruby Hall Clinic so far?
So, first of all, thank you for having me today. I have been in this industry for about 33 years overall, purely an IT professional. I've seen both sides of the world. I've been a technologist earlier. I started my journey as a, trainee programmer, and then I went ahead on the consulting route, where it was a software development environment throughout. And then, of course, about 20 years into the IT environment, I moved to become a CIO and joined hospitals. Because even in the software environment that I worked, we used to develop software for hospitals. And after numerous, implementations and go lives and, really uh, uh, a lot of challenges, I finally came to the other side, that is actually working in a hospital, to understand what it takes to really make a hospital work. And then I have been in the hospitals um, for around 12 years now as a CIO. So, yes, the journey has been excellent. I mean, very, very challenging, very, very, enriching. And here I am now with Ruby Hall for the last 1 year. So there is a lot of work to do here, as well as a lot of growth in terms of IT healthcare.
Thank you so much, ma'am. Thank you so much for sharing the information about your journey so far. So, what has been the most significant milestone and challenges in implementing or working over here or at any other space that you have worked for in healthcare?
So, sorry. Basically, in hospitals, there is a lot of, if the hospital is very old, it is not a corporate hospital, if it is a trust hospital, there are different challenges. And if there is a more corporate driven hospital and there is a more newer hospital, there is a different set of challenges. And when it comes to digitization, the the whole experience is different when we have to select software, when we have to get support from the people, because people are very critical in every aspect of IT, the end users especially. And some are with a set mindset, some are with a newer way of thinking. So we have to be very, very open. We have to be very, very kind of patient in order to, take everyone together when we are talking about any kind of digital growth. And during this time, my journey throughout all the hospitals has been challenging, to the extent that how do we ensure that the users are proactively supporting us with our thoughts as CIOs. And I have been fortunate, very fortunate, in most of the hospitals to have a kind of understanding, have a kind of good interaction with the hospital users. And it has been a journey wherein we have been able to take the right decisions on the digital front. Now, coming back to my current environment, Ruby Hall has been sort of completely digitized from the beginning, even though I've recently joined. So they were always having digital applications, digital, and of course they have still today they have the best of medical technologies, and that is what patients want for better treatments, faster treatments. But when when I joined over here, what we realized that there is no connected ecosystem, and we wanted to bring in that. So that was the first thing that we focused upon, bringing in a connected ecosystem, doing away with any legacy systems which we had, and bringing the latest technologies into the hospital.
Great, ma'am. So good to know that all the amazing work Ruby Hall has already been doing, and also that you are contributing to now with the hospital. So very amazing. And as you said about the connected systems, the government of India is also actively working towards more integrated, more connected systems overall than India in their, reforms as well. So how do you see, Ruby Hall's systems in future connecting with the, national level schemes? And in everything, how important is data security in your opinion? Can you please touch upon that a little?
uh, Excellent questions that you've put up now. So see, basically we are looking, as I said, for a connected ecosystem, and that is the way forward for every hospital, because unless hospitals originally had a mindset that we wouldn't share our data with others, and we wouldn't give our patient information to any other connected ecosystem. But today the government's policies are changing that, with ABA coming in, with ABDM coming in. There is a lot of interconnectivity that is going to be built, and most of the private hospitals will also have to get into that. They will have to play a role in coming into that connected ecosystem. Connected ecosystem is not about just digital or wearables or this and that, but it is about keeping the patient in the center of the complete journey of the hospital, and making sure that wherever the patient moves, the patient is taken care of. And even the government is trying to bring in that by having a central ID, which we call as Abha today. This central ID ensures that wherever the patient goes, the patient will be able to see his or her records in a very connected manner. So today, even at Ruby Hall, we are trying to build that. We're trying to get into that. And with that, of course, I don't want to name the application vendors and all that whom we have onboarded, but we have onboarded a very, very good platform, which is on cloud, number one. So cloud should not be looked at only as a technology, but a central kind of space wherein we can have a more connected environment within our own locations, units, as well as from a more interconnection or sharing of data kind of provisions. So yes, we are moving from a local data center to a cloud environment. We have also onboarded a system which is already capable of connecting to various ecosystem touch points, which may not be a part of our current environment. Like we will become, our system will be M3, ABA compliant, ABDM compliant. Our system will be on a cloud environment. So the connectivity of all the locations of Ruby Hall will also be centralized and connected. At the same time, ensuring that the data security, which you touched upon, will be fully taken care of. We are moving on to one of the very popular cloud platforms of Amazon Web Services. And we are taking care of security from both aspects, internal as well as external. And we are, working towards, first of all, tightening our own internal security requirements. And then, of course, in the near future, or maybe a little later, around a year and a half, we will be completely security compliant with ISO 27002. So that is the way forward for us in the next 2 years journey.
Great, ma'am. Thank you so much for sharing in such detail. We are very happy that Ruby Hall is actively doing efforts to strengthen their data security, especially when it comes to patient data, which is very critical. So most of our audience comes from B2B healthcare background. They are clinicians or entrepreneurs or into healthcare space themselves, but some of them may not be. So while most of them are aware that the DPDP Act, Data Protection, Data Privacy Act, is is the government is working on to it and launching it soon, and also update, making alerts for all the healthcare organizations to comply with it. But most of the but people are in a little gray area when it comes to how will that affect their functioning, how will that affect their output, etc. So can you please talk about that a little bit so as to explain them better? Also share if you have any strategies to comply with such reforms that would be coming in future, near future, very soon.
So actually, Dr. Sarvi, see, I would talk to a lot of vendors in my day-to-day work, and a lot of them come with, fantastic applications which look good, which run well, but then there is always the security aspect that is always a question mark in many cases. People feel that startups especially feel that it is very easy to put up applications and show a use case working. But my take on this is that I would want a very, very secure application. They come with shared databases, they come with shared cloud platforms. They are not really tuned to making it work. So we lay focus on, at least I lay focus on most of these aspects, that we identify who are the vendors with solutions who are actually security driven. They are more prone to, they have experience in the healthcare market. They are not using us as guinea pigs to you know um, push their software. That is one thing. Second thing is that when we look at adopting technologies, especially in Ruby Hall, we evaluate our own use cases thoroughly well. We make sure that, is this going to benefit the patient, or is it just because everybody is going in for it, so let us also go for it? That is like a bandwagon kind of treatment, which is what we do not do. So our Ruby's major focus is on medical technologies, where we can bring the best medical technologies, and these in turn have to be integrated with the IT systems in order to collect the data, especially for the clinicians, especially for the patients, where they get their timely reports, where they get their, your data in on their mobility devices, they get their own, and in the same secure manner that they expect. So data privacy, you said about DPDP Act. People, I'm sorry to say, but most of the clinicians are not really security governed. They feel that treating the patient is the only important thing, and that is right. Of course, even if I'm a patient, I would go and want that. But at the same time, when it comes into a connected ecosystem, we have to keep driving this into them, that okay, when you're using an EMR, when you're using an HIS, you need to ensure that kind of data privacy and that kind of secure login and secure saving of data, and not sharing the information openly, not talking about it. There are many concerns which the data privacy brings in. And yes, that is a long journey in a hospital, but I'm sure most hospitals will come in towards or move towards it in the end, even those who do not consider it today. But it is a necessity and a mandatory requirement now from a government perspective also.
And it is very much important, ma'am. So I am sure you are aware of the recent, data threats that happened in the major hospitals across India, including AIMS Delhi. So if such strong foundations of the country in healthcare can get affected, Of course, it is the responsibility of each and every, hospital owner, clinician, data security personnel to make sure that the healthcare data, the sensitive data of the citizens are well secured. Only then we can have a connected, closed, secured system for our,
Absolutely.
people. So, very much important. And another aspect we would want to discuss is managing the hub and spoke models. So, Ruby Clinic operates across multiple facilities. So, how do you ensure that seamless digital integration happens all across the hospitals, clinics, pharmacies, and the specialized treatment hubs that that are connected? Can you please elaborate a little on that?
Sure. So hub and spoke models are relevant in every group hospital. Wherever we have locations, wherever we have multiple units, it is definitely going to be the architecture. So in Ruby Hall also, even though we were working so long with legacy systems, we had a very strong data center internally, and this data center was connected to every unit. And with a central workforce and a central IT team, it was well taken care of in every measure, with respect to connectivity, with respect to the database, with respect to the accessibility and so on. Now, as a next step, as I said earlier, we are moving to the cloud, which is another way to connect centrally. And cloud brings in a little bit more flexibility, you can say, because then the pressure on our local IT teams is a little less. We can get more supported, you know, um, systems. Like if we are on a cloud, there are cloud administrators who support us for the uptimes, for the backups, for the various things. And if we design the architecture properly, then we have no need to worry about it. Now, where Ruby all goes, as I said, we are the local data center. So even with the core HIMS moving to the cloud, we will still have a lot of systems, other systems like our laboratory information, risk pack systems, many of our other blood bank systems will still continue to be. So we are going in for a hybrid model. The hybrid model will ensure that there is will of course need us to be extremely careful about the integrations. So we are paying a lot of focus. We should pay a lot of focus on integrations so that they are correctly integrated. They give the same results that they would have given being on the same data center. There is a lot of connectivity which we need to look at. So we should have good bandwidth. We should have good internet connectivity. We should also ensure that the in-transit security is well taken care of. The system that we adopt on a cloud should have a good in-transit encryption. There should be a lot of focus on how the backups are taken on cloud, how we are going to ensure our disaster recovery site, how we are going to make sure that if cloud has another benefit, if even if there is an earthquake or God forbid any kind of fire or any kind of this, we will have multiple sets of disaster recovery if you're on cloud. Same thing, of course, we can set up internally also with our central data centers. But then again, we are going to be investing much more in local data centers than we would invest in upfront investment in clouds. So that is a technology benefit when we move from local to cloud data centers.
And definitely,
I
all
hope
these
I've
things
answered most
are.
of your questions.
Yes, ma'am, definitely. And my next question as well, because my next question was on cloud adoption itself. So you answered everything into one. And definitely, these are all very essential when we are talking about modern healthcare institutions. All these
Right.
aspects are very critical and need to be adopted, looked into, and focused at to have a well, rounded, proper system. So, yes. So coming on to another very important aspect is technology-driven customer satisfaction. Um, how, can you please talk a little bit about how such technology adoption can help in overall improving the patient experience and patient satisfaction for the clinicians or those people who are yet not convinced regarding the entire technology adoption game that is going on in the Indian healthcare industry. And can you also share, some ways in in which these kind of adoptions will elevate the overall care that is provided by an organization.
So let me tell you one thing. Patients really don't care about the technology used, what technology you're using, as long as you use the right technology for their medical treatments. Whether you give them a paper report or whether you put a report in their hands on a mobile phone, whether you give them a discharge summary, which is sent to their email, or whether you send them a discharge summary on a paper. See, what patients really look for is the speed of treatment, the speed of their, what do you say, engagement with the hospital. And if technologies can do, yes, if the technology can take care of this, then they are very, very satisfied. They don't want to wait in long queues for an OPD appointment consultation. They don't want to wait in long queues, or they come to the hospital with an appointment and then they are told the doctor is not available. They don't care whether they got the appointment on time through our fancy appointment system. But the fact that if doctor was not going to be available, could we communicate it back to them in time that, you know, do not come to the hospital, or when they are in transit, they can go back instead of waiting for 1 hour and then finding out that their journey is wasted. Similarly, when there is things like billing, Mediclaim, they have to wait for 4 hours, 5 hours after the discharge is given to them for approvals from the Mediclaim insurance companies. Or if their approvals are not coming in time, they are not coming as per their expected, the amounts that they are supposed to be approved for, then that sets the kind of dissatisfaction, and they do not understand the whether it is the insurance company's fault or the hospital's fault. And at such cases, any communication that brings in any technology that brings in a good communication with the patient, timely communication, or this, that is more important. So what we are driving at is, able to connect the patient at every stage of his or her interaction with the hospital. That is our focus. We are already leaders, number one. Today, Rubial is number one, not only in Pune, but in many areas, it is leaders in the country on medical technology. Hence, the patient satisfaction is already driven on that front. We are doing a lot of work for the poor patients as well. So everybody is welcomed for certain things in the hospital. So when it comes to IT, our focus is how to keep that patient engaged with our hospital in the right spirit, in the right timeline, in the right manner. And that is where our HIS systems, our the appointment systems, the laboratory systems play a very big role. For example, if a patient has given his sample today for OPD on an OPD basis, and if his report is delayed and not coming in within 1 hour, or within half an hour, or within 3 hours, depending on the test, of course, the patient is going to be highly dissatisfied. But things like an automated lab, which Ruby all has, a completely automated system, timely reports created in the laboratory management system, timely delivery of those reports to the patient through an email or through a SMS or through a WhatsApp, wherein a chatbot plays a role. Sorry, not really a chatbot, but a connectivity plays a role. These things are crucial to maintain that kind of patient satisfaction. These are the small things which even the vendors who develop systems, they forget. If you have a phlebotomist going to the patient's house, collecting the samples without making the patient run for every little thing, it's very important. Health checkup programs, which we do, there again, we can help the patients a lot in terms of better processes, wherein the samples can be collected faster, the samples can be processed faster, the reporting can be done faster. This is where IT plays a role with better technology. And that is where we keep fighting day in, day out with our vendors also, that, okay, this is how it should work, this is how it should not work. And a lot of, even though vendors have good systems, every hospital is different, and every software goes through quite a bit of, upgrades and enhancements as we progress. Even after go live, even after running the system for 5 years, we may still come up with newer ways of doing the same thing. And there you should have partners who are, ready to help you bring in those changes in a very speedy manner. Sorry, I forgot your something else that you may have asked.
No, definitely, ma'am. You did answer my question, and you definitely again answered my another question as well, which was that how do you select or make sure that you're connecting with the right kind of vendors or partners for managing your technology and data systems in the hospital. Having said that, with
I
all
would
the
like to
discussion,
elaborate a little bit. I would like to elaborate a little bit on your last
yes,
question. See, people think that looking at a flashy system, we're looking at a very grand technology used by the vendor, yeah, we should go in for it, and they start seeing demos and they start seeing everything. What is most important while selecting a vendor or an application or a technology is first to define your correct use case, define your SOP, define what you really want to bring into the hospital as a process, as a use case where you define this is how my application should work, and then go back into the market to see if there is any exactly matching or at least a near match to what you want. Don't look at systems and then decide, oh, let's go for this. Maybe it will help us. That maybe it will help us is not the right way of thinking, because you define your use case. That is what I feel whenever in my past experiences, whenever people, my leaders also used to look at the market, oh, that hospital is using this, why are we not using it? I always, first question is, do you have a need for it? What is the need? How are you going to actually implement it when it comes? And how is it going to benefit the hospital? When you start asking these questions before you look at a vendor, only then you'll have the right application and the right solution in your hands at the right cost, in the right budget. And I'm sure most of
definitely,
my
ma'am.
CIO friends are also thinking like that.
Completely agree, ma'am. Definitely, and also maybe having that kind of partner, technology partner who aligns with your set of principles. Who prioritizes the security measures, the different aspects that you also prioritize as a healthcare facility. So alignment with that is also very much important. Moving on to our very insightful session, we almost lost track of time, got down to the very end of it, but before we let you go, we have two more questions for you. One being related to the industry, and one being related to the future. So when it comes to healthcare IT industry, it is greatly evolving, and when with the advent of such emerging technologies, AI, ML, you know. Data encryption, etc., everything in place all together now. In your view, what are the most exciting trends in the healthcare IT that healthcare institutions should embrace and stay competitive and improve the outcomes in the next 5 years that is to come?
So yes, everybody is talking about AI. Everybody is talking about AI, ML, data science. I mean, the you just talk to somebody and they're all only speaking about this. For the hospitals, the medical technology where the clinicians can be really, supported. The technologies should be thought from that aspect. IT will come as part of it, but that is a little secondary. The primary part is to bring in those kind of medical technologies that are AI driven. When I say AI driven, most of the leaders today do not really understand how AI actually plays a role. And I'm not going to go into that technology, this, details with you, but how the AI is actually working behind the scenes, and how is that AI going to impact your outcomes. This is something that people should understand before saying, I want to bring in AI into the hospital. Where are you going to bring AI? Where exactly? Without understanding how it works behind the scenes. So, if you want to bring in clinical decision making systems, that is what we call as CDSS, the support systems, where it actually, builds information in software solutions, and it drives your, decision making. Will clinicians actually accept that today every medical equipment that we buy new is already AI enabled? These technologies can definitely help the patients a lot, because two things, and especially Ruby Hall is on that uh, uh, this road already, by bringing in the latest MRI, by bringing in the latest CT, wherein which are all AI driven equipments. Even for cancer care, there are lots of this cyber knife is one of them. We have technology which is AI enabled to reduce the time that the patient takes on these equipments for a simple diagnostics or a complicated diagnostics. One, it will lead to, so this AI enabled system will lead to a patient satisfaction from the time spent. Second, it will lead to a better result, a more accurate result, a more informed clinical decision that a radiologist or a doctor would take, a specialist would take. Second is that when we are talking about algorithms that we are building into um, software solutions, a chatbot, for example, which is AI driven. Everybody talks about having a chatbot. Everybody talks about how useful it is for a patient to interact and engage with the hospital. But what we forget is, if your workflow, if the use cases that you really want to, enable for a patient, if those are not designed correctly, if they are not documented and implemented correctly, if they are not developed correctly, it is never going to give the results that you expect. It's never going to give the results that you expect. So whenever we talk about technologies, we have to see where the technology fits in. Now, when during the COVID period, everybody was talking about telehealth. Everybody was talking about, it's one of the very good and key technologies. Today, how much is telehealth utilized? After COVID is gone, really speaking, telehealth as a good technology would have connected you to the remote areas, would have helped the rural patients. They would be bringing the specialist in a networked environment to the rural areas, where primary healthcare actually would have got a lot of support from the modern hospitals. Is it today really in focus? I don't think so. I'm not seeing that trend there. So this is another technology area which needs to be focused upon in the future. If you see, everyone has got good connectivity nowadays. Connectivity, bandwidth, nothing is a shortfall. You pay money, you get good bandwidth. There are technologies which actually survive on good networks. Bring in those technologies. The government that is working on ABHA and ABDM, these are also going to need that interconnectivity. They are going to need you to, build those use cases which will help the patient to carry that, documentation wherever they move around. Today they are in Pune, tomorrow they may be in Mumbai. The patient may have traveled to the UK. Wherever the patient is, the patient will be able to get information at their fingertips of every area of the healthcare treatments that they need. Then wellness is another area where technology plays a very big role. Your health checkups, where a good amount of information is, created through the diagnostics, created through the investigations, created through doctor consultations, and this information also should be available to them. That is again a connected environment as I speak. So when we are talking about AI, ML, telehealth, there is another area where people are not looking into, which is for the old people, the aging people, wherein home care is a very, very critical connected environment that we can focus upon with technology through the right solutions. There are very few companies working on this, though everybody has a small bit developed and given as a solution. So I think we need to, and then all this, of course, has to be, connected to my secure environment.
Definitely, ma'am. And it is so amazing how you've summarized each and every point, in this, a very short session that we had with you. I regret not having much longer time because I could go on and
Yes,
on
please, yes, please.
interacting. But we do have a very interesting patient centricity summit coming up. in December. So we will definitely keep you updated on the same and would love to have your thoughts on
Sure.
that as well. Maybe, dive more deep into how AI is working behind the scenes, that aspect that we couldn't touch upon right now in this one. But with that, we come to the end of
It's a
this
huge
very
topic by
insightful
itself.
session. Yes,
It's a
definitely. Would
huge topic.
love to have this interaction with you. Coming from a public health background myself, whenever I come across such kind of, topics which are very intriguing in nature, I just tend to magnetically get pulled towards that speaker or that issue. So let
I
us
think we have
continue.
lost your time.
No worries, ma'am. I am sure with us as well, the audience as well is enjoying this session so much. So with that, we come down to the end of this very insightful session, ma'am. Thank you so much for being part of this discussion, for imparting us with wealth of knowledge and information. We had Ms. Viloo Williams, Group Chief Information Officer of Grant Medical Foundation from Ruby Hall Clinic. Ma'am, thank you so much.
Thank you so much for having me today. Thank you.
Thank you. I would also like to thank our audience for staying with us till the very end. If you enjoyed this session, please feel free to share your thoughts in the comments down below. If you have any questions from ma'am, please feel free to share those as well. We will make sure to, send these questions to her, get you the answers that you need back. As well as if you have any other topic that you would want us to get into with any specific speaker, please leave them in the comments down below as well. We will get to it. Thank you so much. With that, we sign off now. Stay happy, stay healthy. Bye bye.